If you are a freelancer, a gig worker, or any kind of self-employed professional, you probably noticed something alarming when you went to renew your health insurance for 2026. Your premium went up. Way up. And if you were one of the 22 million Americans relying on enhanced ACA subsidies, you just lost a significant chunk of financial help that had been keeping your monthly costs manageable since 2021. The enhanced premium tax credits are gone. They expired on December 31st, 2025, after Congress failed to extend them. And for freelancers who buy their own health insurance through the ACA marketplace, this is one of the biggest financial hits of the year. The average subsidized enrollee is now paying 114% more in premiums compared to 2025. That is not a typo. Premiums more than doubled for millions of people. Welcome to the Freelancers Wealth Blueprint, where we help freelancers, gig workers, and self-employed professionals understand taxes, build savings, and stop leaving money on the table. If that sounds useful to you, subscribe and hit the bell so you never miss a video. Let us break down exactly what changed, what your options are, and how to use your self-employed status to actually fight back against these higher costs. First, what exactly expired? From 2021 through 2025, Congress passed temporary enhancements to the premium tax credits under the Affordable Care Act. These enhancements did two major things. They eliminated the subsidy cliff at 400% of the federal poverty level, so even higher income freelancers could get help. And they capped everyone's premium at 8.5% of household income, regardless of how much you earned. Those enhancements are now gone. The subsidy cliff is back. For a single person in 2026, 400% of the federal poverty level is approximately $63,840. If your modified adjusted gross income is $1 above that line, you get zero premium assistance. Not reduced assistance. Zero. That is why they call it a cliff. And for freelancers with variable income, this cliff is especially dangerous because your income can fluctuate month to month, making it extremely difficult to predict where you will land at year-end. Here is the other side of the cliff problem. If you underestimate your income on your ACA application to qualify for subsidies and then earn more than expected, you have to repay every dollar of excess premium tax credit when you file your taxes. There is no repayment cap anymore. So if you guessed wrong by $10,000, you could owe thousands back to the IRS at tax time. For freelancers with unpredictable income, this is a real risk. Now, let us talk about your actual options for health insurance in 2026. Option 1. Stay on the ACA marketplace. The subsidies are smaller, but they are not completely gone. If your income is below 400% of the federal poverty level, you still qualify for premium tax credits. The key strategy here is managing your modified adjusted gross income to stay below the cliff. And as a freelancer, you have tools to do this that W-2 employees do not. More on that in a moment. Option 2. Switch to a high-deductible health plan and pair it with a health savings account. This is one of the most powerful moves for self-employed people. A qualified HDHP through the ACA marketplace lets you contribute to an HSA. For 2026, you can contribute up to $4,300 as an individual or $8,850 for a family. Those contributions are tax-deductible, the money grows tax-free, and you can withdraw it tax-free for qualified medical expenses. That is a triple tax advantage that no other account offers. The monthly premiums on HDHPs are lower, which helps offset the loss of subsidies, and you are building a tax-advantaged medical fund at the same time. Option 3. Explore alternatives outside the ACA. Short-term health insurance plans are available in many states for up to 36 months. They tend to have lower premiums, but they do not cover pre-existing conditions and are not ACA compliant. Healthcare sharing ministries are another option, with individual memberships starting around $135 a month. But understand, these are not insurance. They are not regulated. There is no guarantee your medical bills will be covered. They can also deny coverage for conditions that conflict with their stated values. These alternatives carry real risk and should be considered carefully. Option 4. And this is where freelancers have a real advantage. Use retirement contributions and tax planning to control your modified adjusted gross income and stay under the subsidy cliff. Here is how it works. Your MAGI determines your subsidy eligibility. Contributions to a traditional 401k, a SEP IRA, a traditional IRA, and an HSA all reduce your MAGI. So if your freelance income is $70,000 and you contribute $10,000 to a SEP IRA and $4,300 to an HSA, your MAGI drops to $55,700. That could be enough to keep you under the 400% FPL cliff and preserve thousands of dollars in premium tax credits. This is a strategy that only self-employed people can execute effectively because you control both your income and your deductions. W-2 employees have far fewer levers to pull. You can also time your invoicing, delay certain income to January, or accelerate deductible expenses into December to manage which tax year your income falls into. This is not tax evasion. This is strategic tax planning, and it is perfectly legal. Do not forget the self-employed health insurance deduction. Even if you do not qualify for subsidies, you can deduct 100% of your health insurance premiums as an above-the-line deduction on your tax return. This goes on Form 1040, Schedule 1, Line 17. It reduces your adjusted gross income directly, which lowers both your income tax and potentially your self-employment tax. If you are paying $800 a month in premiums, that is $900 to $600 a year in deductions. That alone could save you $2,000 to $3,000 in taxes depending on your bracket. Here is your action plan. Review your current ACA marketplace plan and check what subsidies you still qualify for. Calculate your projected 2026 MAGI and see how close you are to the 400% FPL cliff. Maximize contributions to your SEP IRA, solo 401k, traditional IRA, and HSA to lower your MAGI. Consider switching to a high-deductible health plan paired with an HSA if you are generally healthy. Keep your income projections updated on the marketplace throughout the year. And claim the self-employed health insurance deduction on your tax return, regardless of whether you receive subsidies. The enhanced subsidies are gone, but the Freelancer's toolkit for managing health insurance costs is still powerful. You just have to know how to use it. Subscribe for more strategies built for self-employed professionals. See you in the next one. This content is for educational purposes only and does not constitute tax advice. Consult a qualified tax professional for guidance specific to your situation.